For many, the very sight of a leech evokes horror. These creatures, with their slimy bodies and sharp jaws, are the stuff of nightmares. But beyond their unsettling appearance lies an ancient medical practice still in use today. From the lavish palaces of ancient Egypt to the cutting-edge laboratories of modern science, this therapy has intrigued and perplexed humanity. While it's often shrouded in taboo and fear, its resurgence in contemporary medicine is forcing society to reconsider its place in the medical world. But how does leech therapy work? Why does it evoke such strong reactions? Can modern science truly reconcile with this ancient method? In this video, we discuss the science, the controversies, and the surprising efficacy of this unconventional treatment. Leech therapy's origin date back over 2500 years. It was widely practiced in ancient Egypt, Greece, and India, with records of its use appearing in early medical texts like the Ebers Papyrus and Hippocrates' teachings. Leeches were used to treat a variety of ailments, from headaches to infections, under the belief that removing bad blood could restore balance to the body. The practice reached its peak during the Middle Ages and Renaissance, when physicians used leeches for nearly every ailment, often in conjunction with bloodletting. However, by the 19th century, skepticism about its efficacy, when paired with the advent of modern medicine, led to its decline. The sight of a leech attaching itself to the skin and sucking out your blood can be unnerving, even horrifying for those unfamiliar with its medical application. This aversion has contributed to leech therapy's status as a taboo in some cultures.
Only if there is nothing in the world that can save me from whatever I'm going through.
If I see a leech, I can't stand it. I won't even go near it.
But how does it actually work? Well, leech therapy involves the controlled application of medicinal leeches, primarily the species Hirudo medicinalis. These leeches are specially bred in sterile environments to ensure safety and efficacy. The process is straightforward yet highly specialized. The leech is placed on the target area of the body. Once it attaches, it uses its 3 jaws to make a small incision. The leech secretes saliva into the wound, which contains a cocktail of bioactive substances. It then consumes a small amount of blood, usually 5 to 15 milliliters. After feeding, the leech naturally detaches. The wound continues to ooze for several hours, aiding in further drainage of blood. The secret to leech therapy lies in the leech's saliva. It contains over 100 bioactive compounds, each with specific therapeutic properties. For example, hirudin is a powerful anticoagulant that prevents blood clotting. Kaolin prolongs bleeding by inhibiting platelet aggregation. Hyaluronidase enhances the spread of medicinal compounds in tissues. Dalins and iglins, anti-inflammatory proteins, reduce swelling and pain. The saliva also contains anesthetic compounds which reduce pain during the process. These compounds collectively improve blood circulation, reduce inflammation, and accelerate healing. Modern research has validated many of these effects, particularly in microsurgery and chronic disease management. The confidence around this therapy has reached a level that leeches are being used as a natural remedy for quite a few medical issues. For example, in reconstructive surgery to enhance blood flow in reattached body parts, such as fingers or ears. When veins are damaged or insufficient, leeches help prevent venous congestion, ensuring the survival of the tissue. Similarly, patients with conditions like varicose veins and deep vein thrombosis benefit from leech therapy due to its ability to improve circulation and reduce swelling. Studies have shown that leech saliva's anti-inflammatory properties can alleviate pain and stiffness in arthritis patients, providing relief without the side effects of conventional medications. Hirudin's anticoagulant properties make leech therapy useful in preventing blood clots and improving circulation in cardiovascular conditions. Leech therapy is gaining popularity even in the beauty industry, touted for its ability to improve skin health and reduce signs of aging through enhancement of blood flow. Quite a few recent studies and clinical trials have demonstrated the efficacy of leech therapy. A 2011 study in the Annals of Plastic Surgery found that leech therapy significantly improved outcomes in reconstructive surgeries. Research published in Arthritis Research and Therapy showed that leech therapy provided lasting pain relief in osteoarthritis patients, outperforming some standard treatments. Patients often reported reduced pain, improved mobility, and faster healing after leech therapy sessions. Of course, the results can vary depending on the condition being treated and the individual's response. Despite its benefits, leech therapy is not without controversy. Critics question the risk of infections and complications, though those are rare when using sterilized medicinal leeches in controlled settings. Some experts remain unconvinced, arguing that the evidence is insufficient or biased by anecdotal reports. The use of live animals in therapy raises ethical questions, particularly for those concerned about animal welfare. These controversies highlight the need for rigorous research and standardization to address concerns and validate its use. Modern science is increasingly recognizing the potential of leech therapy, though it remains a complementary treatment rather than a primary one. Advances in biotechnology are enabling researchers to isolate and synthesize the bioactive compound in leech saliva, potentially creating new medications inspired by this ancient practice. The therapy's integration into mainstream medicine will depend on three major factors. Large-scale, high-quality clinical trials are needed to establish its efficacy and safety across various conditions. Healthcare providers must be trained to administer leech therapy safely and effectively. Overcoming the stigma and fear associated with leeches is crucial for wider acceptance. Leech therapy stands at the crossroads of ancient wisdom and modern science. While controversies and challenges remain, the growing body of evidence suggests that leech therapy has a rightful place in the medical world, not as a relic of the past, but as a bridge to future innovations in medicine.